Thank you so much for joining us. I know an incredible amount of work has been done by our co-chairs, our staff, and you as members of our commission between the last meeting and this meeting, and I am even more enthused now than we were conceiving of setting up this effort and getting it started based on the work that's been done. So in the interest of time and everyone's time here and moving us along on a busy agenda today, I'm going to turn time over to Gail Miller as the co-chair, and Palmer, you as well, I think, and then we're just going to work our way through the agenda. So thank you all for joining us. We're looking forward to a good afternoon, Friday afternoon at that.
Thank you, Mayor. I too would like to welcome you all here and thank you for your service on this commission. You have been tremendous. The process is going forward very nicely and we appreciate all of your input. I know most of you were introduced at our last meeting, but we do have a couple new members, so I'd like to turn the time over to Pamela to introduce her, the person sitting beside her that will be added to the commission.
Thank you, Gail. I'd like to introduce Sierra Argyle, and this is Mackenzie, who is 9 weeks old.
Yes, he's here.
We felt that Sierra would really add something to our commission. She has been in the shelter, she has been in rapid rehousing, and she's now in Palmer Court. And she's not only the mother of this wonderful little baby here, but also the mother of 6-year-old twins. So she's had quite some experience, and what I like about Sierra is, you know, she can see what is good and what has not been so good in her experiences, but she does have suggestions of how to make those experiences better for everyone. So we're glad to have you here. Thank you, Sierra.
Thank you, Pamela, and welcome, Sierra. I would also like to give Sheriff Winder a little time to introduce himself and tell us a little bit about your reason for being here.
Thank you very much, Ms. Miller. Jim Winder with Salt Lake County, currently functioning as the sheriff, and honored to do so. And a common question we receive is why would the sheriff be involved in homelessness issues? I think the question, although very legitimate, oftentimes belies what is a common misunderstanding that unfortunately the system we manage oftentimes is a place that is either the beginning point or the end point of those individuals that find themselves in very difficult circumstances. We are, unfortunately, a homeless shelter of our own. We are one of the largest providers of indigent health care in our community. We are one of the largest recipients of individuals that unfortunately suffer with mental illness. And we are a very common place for those that suffer financial hard times. So either individuals coming to or leaving this circumstance will find themselves in our facility, and we hope to break that cycle. And we're thrilled at the efforts by Mayor McAdams and Mayor Becker and yourselves in this panel, and we hope to do all that we possibly can to assist in breaking what is really a vicious cycle.
Thank you.
Thank you.
I'd also like to thank Palmer DePaulis, as he's helped me as we've worked together, and he has helped me to get through this process. He and I, along with several of the staff members, have been meeting in small groups or one-on-one with each of you so that we can make sure your voice has been heard and that we understand what your interests and your needs are for the homeless. What we've discovered is that there are many, many similarities in what you're saying. The issues seem to be very evident, and there are some skeptics out there that don't believe we can change anything, but by far I believe there's a feeling of hope that we can bring a suitable solution to the needs of our homeless friends, our neighbors, our businesses, and our communities as a whole. And we, as a commission, are skeptically optimistic, or generally optimistic, we're not skeptical, that this commission will be successful in bringing good ideas forward and implementing a change that will be acceptable to everyone that's involved so that we can feel good about what we've done. So thank you for your willingness to share your views with us. Thank you for your insight. Thank you for what you do to help our homeless friends, and thank you for being a part of the solution. Palmer and I are very appreciative that you've been so open and so forthright in giving us your thoughts and your concerns and your suggestions. And with that, I would like to turn the time over to Michelle, who will facilitate this meeting.
Okay. Oh, I just turned it on and now it's all hollow, but that's not me, right? Somebody else does that. Okay, so I've been asked, even though I did not participate in any of these small group meetings, sorry, you don't need to see me dress myself, but I gotta get this thing on here. I've been asked to summarize what was heard in all of those meetings. Yes, it's lovely. And so I'm going to do that. And I want to thank everyone again on the commission, and then if there were any of you in the audience that participated in other small group meetings that were held, thank you so much for your time and for sharing a lot of really valuable information, which I now get to summarize in 15 or 20 minutes. Quite the challenge. So I'm going to read off my piece of paper. You also, Christian in particular, knows that some of these meetings went until yesterday. So we have compiled a lot of information in a very brief period of time. And at the end, then, when I'm done with my presentation, I hope that we'll have group discussion, or actually an opportunity for you all to let us know whether we missed something big. And no, that's not right. Get that off. Gone. Okay. So I'll just, so I've been asked to sort of to pull out from what these different group conversations were the factors of success, or factors for success that we've heard from all of you. And the sources of information, we did go back over the situation assessment, which was done, was published at the end of 2014, 2013, whatever. Recently. And in that assessment, we did 60 interviews across all the different sort of stakeholder interests, if I use my lingo. Now, since the last meeting of this commission, there have been small group meetings with the commission members, and you all have participated in those. There's also been group meetings with homeless individuals, and I'm told they've met by now with more than 100 homeless individuals to answer the same questions that you were asked. And there was one group meeting in Mayor Becker's office with interested community members, which involved some volunteers, included some volunteers from the shelter, and then a bunch of other people as well. And just to refresh your recollection on what it was you all were asked what are the essential elements or the factors for success for placement of homeless services? Are there any gaps? Are there any other cities we should be looking at as a model? And what's the main interest that you want to have satisfied in this process? And as Gail mentioned, we heard a lot of similarity across the conversations. And what I have always found most interesting is that the homeless individuals have the same concerns, essentially the same concerns as the residents and businesses, and the service providers share those same concerns. So, I mean, there's obviously differences, but in the most part, it's a lot the same. We also heard a lot of good ideas about how to improve current services, how to connect homeless individuals with jobs, how to increase accountability for homeless behaviors. For today's summary, I'm really going to focus on sort of the facility location or facility configuration aspects of what we heard. And in the interest of time, I've synthesized a lot of really wonderful information, which is on maybe 20 or 25 pages of typewritten notes into this, which I hope is sort of what I think of as the gold nuggets. But so anyway, I got to do my disclaimer at the beginning because I feel a little bad about having to winnow it all down. So what were the priority concerns that we heard? Safety and security, I don't think anybody's going to be surprised about that one. And we heard this early and often, and we heard it from everyone. And we heard it from homeless individuals, service providers, residents, businesses, everybody we talked to talked about safety and security. And safety and security involves both personal safety and safety of belongings or property. And the primary message I think that we heard was get the drug dealers out and keep the drug dealers out. Okay. Community buy-in has kind of two aspects of it. I think first off, there's confidence that we have community buy-in to do something. There's not necessarily full agreement on what that something might be or what needs to be done, but the community is very compassionate and is scared and possibly underinformed about the struggles of the homeless population and what would help them most become self-sufficient. But I think that community concern is also our strength. And it really represents a community commitment to help. And the other part of the community buy-in, the concern that we heard was a concern about creating community buy-in for whatever comes next. So a lot of questions about which neighborhood is actually going to be willing to accept facilities. And everybody wants a downtown and a community that's welcoming to all, including homeless people. The third concern or priority interest that we heard is that the current facilities and services can be improved. And there were, as I mentioned, many specific suggestions, but the overall themes were we need to start helping individuals immediately. As soon as a homeless individual is in contact with the system, whatever that is, we need to be able to start giving them help. We want to reduce the length of time that people experience homelessness. We want to facilitate their ability to transition out of homelessness, so basically help at all stages of homelessness, and provide more help to non-chronic homeless individuals and families. And again, as I go through what we heard, I'm going to be focusing on the facility location and configuration aspects of those themes. And I'm not going to go through them. Those are the biggest facility-related gaps that I think we heard about, and you'll hear a little more about them as I go through. Sorry, I have handouts. So sorry. And the handouts are what I'm talking about. Here we go. You could take notes. Sorry. There we go. Okay. The way I'm going to do the presentation is sort of 3 categories of things. I've broken it down into 2 primary ways of thinking about it. What are the functions that we need to provide in whatever facilities we're going to have? And many of these are already provided, but basically, what are the functions that people in an ideal world feel should be offered? And what are the physical characteristics of the neighborhood and or the structures themselves that will create the greatest opportunity for success? And that's kind of what I've tried to pull out from what all of you shared with us. And then there are some practical considerations, which when I get to that at the end, everybody's going to go, yeah, we knew that. But I have to identify them. So we heard differing opinions, and I am not necessarily going to go over all those differing opinions, but some of the functions we were told can or should be provided in multiple locations. Some of them should be provided in one place. Some of them should be provided in every location. And for now, I'm just going to list the functions and not go through all of those differences of opinion. The other thing to note before I get going is that there was a recognition that there's differing needs of different homeless subpopulations and for each homeless individual. So there's not one approach that meets every need. And we want to make sure that we have facilities that are flexible enough to meet sort of all the needs of all the different groups of homeless population and all the different individuals. So the functions we think are important, what we heard from you. And we need adequate facilities, so enough space. Just for every single one of them, think of, we need enough space to do that. That's kind of what this is. So we need enough space to provide ID checks. And we heard from a lot of people that it would be beneficial to limit access to facilities or structures to those with ID. And so if you're going to do that, you need to have space to do that, space in the facility to do that. You need enough space for intake to provide an immediate connection for the homeless individuals with needed services, and you need enough space for outreach. That means actually more sort of going out and finding them. It may not be so much a space, but you might need space for the information that you bring back to deal with it. One of the things that I actually found interesting was there were a lot of comments that the potential clients for these facilities, for these services, are not necessarily only the homeless. To the extent that we're trying to prevent homelessness and prevent people from coming back into homelessness, a lot of the services actually can help people sort of across the board, not people that you necessarily think immediately as homeless. So it's just something to think about, and in terms of space requirements, may inform how much space you want to provide for certain types of services that help prevent people from going into homelessness in the first place or going back into it once they've already been housed. You want to have space. We heard that you want to have enough space for case managers to help individuals transition out of homelessness. And that would be office space for shelter staff and for the resource agencies, and also space for this intake kind of activity. From the homeless individuals in particular, we heard about weekend and evening caseworkers as being something that's very important to them. And employment support. This I have, so in my notes, I have everything that was really strongly held views by the homeless community in blue. Everything under employment support is in blue, which means that the homeless community, the homeless individuals, especially talked about wanting to have space and the services for this. They obviously want more employment opportunities, but they also talked about training, about education, GED programs, that kind of thing, vocational rehab. So these are all important things for which we would need to provide adequate space so that this employment support can be provided. Okay, this one gets its own page. The adequate facilities for day services. And this is, I'm not going to go through the whole list. This is probably only a partial list of what people wanted to have, said they would like to see provided in a day center. I'm going to emphasize the daily and long-term storage of worldly belongings. We heard a lot, especially from the folks the homeless individuals whose belongings would be stored. They would like it to be affordable. They'd like it to be a safe place, a personally safe place, and secure storage. And also that, if possible, it would be available for longer than 2 weeks. So long-term really means long-term. And that, in terms of space, may be a big consideration. Some of the others, daycare was mentioned a good bit, and safe place for medical supplies and drug dispensing. And again, the identification that having day center or day facilities open during the weekend. Essential personal health services, mental health, and for mental health services, it was room or enough space to do the initial evaluation of whether somebody would benefit from those services or not, to provide beds if that's needed, and to provide ongoing support for the individuals. Same for detox for the most part, and from some homeless individuals we heard actually quite a few times, requests for Alcoholics Anonymous and Narcotics Anonymous. I think that is meetings, throughout the day. Medical, obviously, more dentists was a request, pharmacy, and then restive care and hospice care restive care apparently is when you're recovering from, I had to learn some new words. I do know what hospice is, but restive care apparently is when you are recovering from an injury or being in the hospital, and hospice care is end-of-life care. Okay, so essential personal health services, and then a shelter. In terms of space for the shelter, what is it that people were talking about as sort of the needs, the ideal would be enough space, enough beds so that families with children don't need to move once they've been placed in the shelter. They don't need to move to another place a couple weeks later, so that they can provide a stable structure to the daily lives for their children. Adequate space or adequate beds so that individuals don't need to check out at the end of the day and check in again the next day. We heard a lot of stories from homeless individuals about the difficult choices that they need to make between actually going out and looking for work or going to do work versus standing in line and waiting to get a bed. So the adequate space and beds seem to be a very significant concern and interest. Again, storage capacity for belongings, and I'll just focus on the final one is in terms of the shelter. We also heard that to the extent that there are rules, and that there are rules about who can be in the shelter or not be in the shelter, that there be a very intentional consideration of what do you do with the homeless individuals who perhaps don't meet those rules and then have to do something else other than stay overnight in the shelter. With a lot of discussion about don't do any harm, don't create a new problem, things like that. Next, adequate facilities is open outdoor space that's dedicated for homeless population use. So they were looking for a park, a hangout space, public space where they can just hang out, but that is protected and safe and secure for them. People had suggestions about a garden area, and there was a lot of discussion about secure playgrounds for the children. Space for community partnerships, and some of the partnerships that were mentioned were Boys and Girls Clubs, and then volunteer organizations, and perhaps even space to help them train their volunteers. And housing, which I don't think anybody's going to be surprised that we heard a lot about housing, so I just summarized it there, and know that we need to say a lot more about that. So that's the end for now of the list of functions. But then people also had suggestions about which functions, in their opinion, should be co-located and which functions, in their opinion, should be kept separate. So this is the co-locate slide, and the next one will be the keep separate slide. The functions that people suggested should be co-located was the multiple homeless services should be within walking distance or in close proximity so that one individual can make their way around to all of them, hopefully in a day. We also heard that shelter, any emergency shelter and services should be co-located, especially mental health and detox and the case managers. We heard that the shelter and transitional housing being co-located would be a good idea, and that co-locating housing with support services is a good idea. And then some people talked about wherever you provide food and services, if you did that in the same place, that would help because people wouldn't have to leave. They could get everything that they want in one place. Now, many people said these kind of things. It would be good to co-locate these things, but to be totally sort of open, we also heard quite a few comments about please don't cluster the resources because we want to discourage the congregation of the homeless in one area. So that's a tension to work with there, I think. Okay, which functions to keep separate? The men's and the family shelter spaces should be kept separate or should be separated. We heard that from many, many people, in particular from families who have experienced homelessness. Some people talked about keeping the family separate from the downtown shelter or any crime area, so provide safety for the children who are experiencing homelessness. And many of the families and the moms talked about ensuring that the view from playground areas or the ambiance that their children are in while they're in an emergency shelter area should not include criminal or violent behavior, shouldn't have evidence of unhealthy lifestyles like drug paraphernalia and things like that. So that was kind of, I think, the background behind separating the two types of shelter spaces. The other functions to keep separate were youth shelter services from adult shelter services, especially the new homeless youth shelter. And then some people suggested that it's not necessarily keeping separate, but place permanent supportive housing, kind of scatter it around the county rather than having it all in one place. I'm going to now move from the functions to what you suggested as some of the physical characteristics of a neighborhood or structures that would create the greatest opportunity for success for the homeless individuals that are being helped by the facilities. And I just want to make a note that some of the solutions or some of the ways that one can get these physical characteristics, some of them can also be done through management changes at a facility, or both. It can be a structural solution or a management change. So one of the things that we heard about a lot was self-contained facilities as a way of internalizing the activities. So to minimize overflow into neighborhood public spaces and to focus especially on building entrance design so that if people either come up with a way that people don't need to queue up at all, or if they need to queue up, have it be in non-public spaces, is we heard about a lot, actually. That the drug traffic be easy to control, that the dealers can't hide in the homeless presence, and there were a variety of suggestions of how to do that. For the most part, they kind of fell into street configuration, landscaping kind of ideas, and then facility design, again, especially the front entrance area. Heard a lot about easy access. Whatever facilities we have for the homeless population should be easy access so that the homeless individuals can easily connect to services and jobs, and also to allow community volunteers to reach the facility easily. So suggestions were location near public transit, preferably the free zone, or provide some kind of vouchers so that the public transit is in fact no cost. And or provide private transportation services, for example, shuttle vans or something like that, as a way to make sure that people, if they're not near public transit, can in fact get to services and jobs. And we heard a lot of stories from homeless individuals that they either need to have a car to get to jobs, which is makes it difficult, or that some stories about single moms or others have to do favors, which I wasn't there to hear the story, so I don't know what the favors are, but they had to, that's just what the notes, I saw it in the notes several times, have to do favors to get rides or get rides with people that they don't necessarily feel so comfortable with. So this access piece was very, very important for everyone, but in particular for the homeless individuals who would be using these facilities. Okay. See? She agrees. Okay, emergency shelter, we heard, should be centrally located and not isolated. The family shelter should have good access to schools. There were a lot of different opinions about the preferred location, and obviously that's why we're having this particular exercise, this commission, this group working together to help inform the where should it be discussion with the how and the why information that we've been collecting. We heard, especially from homeless individuals, that it'll be important to have clear signage and communication about the facilities, where they are, how to get to them, both to help direct the homeless to the needed resources, but also to help community members identify ways that they can help. So there were a bunch of ideas around that. I mentioned already sort of flexibility in the potential use of the space, and some of the things that people talked about there was room for growth, but also the ability to expand or shrink the services provided in a facility based on what's happening at the time with the homeless population. So that could be seasonal, that could be year to year, it could be as the economy waxes and wanes. So flexibility in how you use the space. Suggestion that it blend into the neighborhood. Suggestion to create a community feel, which there were a couple components to that, but one was create a community, whatever facilities there are should create a community feel to replace the current habits of gathering in specific downtown locations. And then many of the homeless individuals said they really would like to see a place that's not chaotic, so that the place that they're in, the structure that they're in, doesn't add to the chaos that they're already feeling in their lives. It was suggested that we pay attention to building ambiance. We should have bright and airy rooms. The building needs to have flow. It gets into more architectural design kind of things. And the final two things here are adequate room or orientation to support security measures. And some of the security measures that were identified were cameras, metal detectors, a security patrol. I don't know what all those security measures might be, but to think about that intentionally as you're selecting locations and as you're designing facilities so that they can support the security measures. For the homeless population in particular, they talked about wanting to see 24/7 security in these facilities. And to facilitate the use of technology to make the process more efficient, and here are some of the technologies that were talked about were ID, barcodes, tracking systems to help move people through the system. And to the extent that that might require space, to think about that as you're picking. Messaging via TV screens, automation to increase case managers' efficiency, and some sort of systems to reduce queuing. So again, I don't think people are necessarily suggesting you should do any or all of those things, but think about if there's a space requirement for that, think about it as you're kind of thinking about where would we place these things. The final page is a little more detailed in a way. I don't want to minimize it. I'm just not going to spend much time on it. I think you can just kind of read it. Design against bugs, handicap, design for privacy, and there actually some people said, please have doors on the restrooms. Okay. Accommodate homeless individuals with pets and provide safe smoking areas. So that's a lot of physical characteristics. The final thing is the practical considerations that we heard in here. Again, if I had asked you to make a list right now, this is the list you'd make. So you want to think about cost. And for that, we heard about both the immediate cost to renovate or relocate or build or whatever it is that might actually be done, and not to forget about whatever ongoing costs there might be. To an interest potentially in retaining and recouping investments in existing facilities, especially to the extent that there are new facilities that have just opened or are in the process of being designed. Funding, how is it going to be paid for? And there were a lot of different views on how it should be, how the ownership of these buildings should be structured, and whether other cities in Salt Lake Valley or the state should help, and all things like that. The one thing I want to emphasize is that there were we heard a lot of ideas about how to find funding, and I think I at least found that pretty encouraging, that it wasn't like, oh my gosh, how are we going to pay for it? And it also wasn't, oh, here's the check. But there were lots of creative ideas about, once it's kind of figured out what to do, that the funding probably can be found. And the final one that I think I probably don't need to say very much about is zoning as a practical consideration. So with that, I want to kind of open it up to the group. And I'm going to go, because it's a large group and doing group discussion in a large group like this is hard, I'm actually going to do you a little section by section. If that's, yeah, I know. Already, you're like my students. Oh my God, she's actually going to look at me and ask me a question. That's the question that we're going to ask. Are there any key factors for success that are missing? And I'm not going to apologize, but I recognize I went through it very quickly. And there's much, much more detail and nuance to go, but we don't have time for that today. So if there are key factors for success that are missing, I'm going to write them up here on the board. We're going to take a picture of them and integrate it into this, into sort of this summary and the longer list. So I need this. And how about if I sort of vaguely, not look anybody really in the eye, but sort of over here. Are there any key factors of success that we've been missing? Yes, please.
I thought the presentation was excellent, but I am struck by the fact that one of the issues of data analyzation and centralization to identify, I know there are a number of statistics that we can all reference that seem to suggest that what the homelessness problem is, but I think because of the disparate service providers, it's difficult to really get a handle on the true nature of it, and therefore it is difficult to say if any of these measures have specific impacts. It would be very nice at some point in time to have a one-stop shop that says here is a snapshot of the homelessness situation in Salt Lake County, in particular, and here is the reductions in the respective populations, i.e. families, veterans, adult males, individuals with drug and alcohol problems, mentally ill, seriously persistently mentally ill, breaking it down in those subsets, because I think that allows us then to target funding and resources towards the subsets rather than viewing the homeless as some monolithic group, when in fact they are in very different circumstances, as our wonderful guest here demonstrates today. Thank you.
So if I want to make sure I capture that right. I'm hearing kind of two pieces to that. One is a snapshot in data of who the homeless population are in Salt Lake County, kind of break down by groups, and make sure that we target what we do to those different subpopulations. Is that fair?
Correct.
Okay. Oh. Okay. Other, yes.
You know, we focus on who's already homeless and what their circumstances are and how can we help them. I wonder if there's a way that we ought to consider the factors that lead up to homelessness, and can we do some prevention so that it limits or decreases those that fall into that category by providing some of the services, employment services or health services or other things before they actually reach the point of homelessness.
So, yes. So ID factors to prevent homelessness. And one of the things that I'm going to, you suggested employee services and health services, and I know one of the things that we heard was affordable housing as well. Are you okay if I add that up there? Okay.
We tend to draw a line and say someone's either homeless or they're not homeless, but I think there are more categories than that.
Yes, and if I know I'm the facilitator, I'm not supposed to add substance, but I'm going to. Okay. It's preventing homelessness, and then at the other end, it's preventing people from coming back into homelessness, because I know we've heard a lot of stories about folks who have sort of been through several times, and so I think your suggestion would be very helpful. Other key factors we may have missed. Yes, ma'am.
We need a closer relationship between corrections and people who are moving out into the community with very little support and being considered unimportant or problem people. I mean, they're all people. So I think a cooperation between corrections and services needs to be made.
Closer connection with corrections with a capital C at and after release. Does that fairly capture it?
Yes?
Great. Okay. Gonna move on. Yes.
Just a comment on coordination. I think it's been said here, but it seems to me there's a lot of support and attempts at coordination, but connecting that for prevention resources as well that might help people connect with these resources without having to physically go on site, but have some coordination that revolves around the individual who needs the support as opposed to just the physical site.
Okay, so coordination of services, so individual does not need to physically be there. Is that fair? It's not very articulate, but does it get the idea? Is that?
Yes.
Yeah, okay. And in terms of sort of, yeah, that's a space and possibly technology issue. Maybe, I don't know how to solve it, but okay. So we're gonna go, I'm not ignoring you guys, I'm trying to make sure I get everybody.
Okay,
I am right now.
I'm trying to get this to shoehorn in here, Michelle, but I want us to be able to somehow project future growth, and we can do it in the broadest terms, population, and then we can get more specifically into population of people living at different income levels, and then the housing needs for people living within those income levels, and what the ability to pay for housing will be among those populations, and how we will create the housing going forward that will grow to meet not only the gap that currently exists, but close that gap and grow to meet future demand. And I think we need to look at those various causal factors, that there could be other causal factors that we're currently doing now that are exacerbating the problem. And so do we feel comfortable that we've addressed all of those, that we've identified all of those? I'm not sure that we have, and I'm not sure that I have like the missing piece to offer you. And what is the trajectory of this growth? Are we going to say that the population of people experiencing homelessness is going to be 1% in the next 5 years of the total population, and 1% 10 years, and 1% 20 years from now? And how do you factor in creating all of the space considerations that we're taking into account to meet that future demand?
Okay, so you're going to have to help me because, as usual, you have so much in your one sentence that I can't get it all. Okay, project future growth or trajectory of people experiencing homelessness.
I would just say project future growth, and then we have we have myriad subsets.
Yes.
And it starts at the most
cetera.
general in terms of population.
Okay, we got it.
And then,
Good.
And then we have many places to go.
Good, thank you. I'm going to start moving. Not that now I'm not ignoring you, but we're good. Okay, we're moving around. Yes, Jason.
So I'm interested in understanding more gaps in facilities. So things like medically assisted detox or emergency shelter for families so that they don't get bounced around, but that they have one emergency shelter room or home while they're waiting to move into housing. But I think there are gaps in facilities like that that we should be addressing. I also think another factor for success would be helping us identify sort of short, medium, and long-term problems, issues, solutions, so that we can start to say there are things we can do immediately, and then there are things that might take a little bit longer, and having an understanding and managing expectations for that.
Phased approach.
Okay, whoever's taking pictures, it's getting time. Whoever's the picture taker. Okay, so what I have is gaps in facilities, quantify the current gaps, is that what you're after?
Yeah, just those two examples. So, a location for families so they don't get bounced around, and school to school. And then the other was medically assisted detox. Those are just examples, but I think there might be some other gaps in facilities we could look at.
Well, yes, I mean, there are. Families, please, thank you. Mental health facilities was, I know, is one that came up an awful lot, so. We good? Thank you. Of course. Okay. So all of you can tell that I didn't go to the facilitation training school where they taught you how to write well. Okay, sorry about that. Okay, yes, Scott.
You know, what we're doing here is we're really moving a culture of transformation. And when you look at this, I was impressed with what everyone had said. What came to my mind was the co-location of a virtual e-integration as many of the services as possible. So you integrate, and I use the word E because that's the technology term of electronic, or trying to see what we can implement technology into that. I think we also need to talk about rewarding positive attitudes, and then also dealing with negative behavior within a shelter or within a community of that. I think someone over here, maybe it was Sheriff Winder, talked about kind of setting up a data metrics. We really don't have accountable data right now. It's not data that we can really get our arms around to say where are we going and what are we doing. And I think once we get the data metrics set up, it could change the face of everything. So every day, Ralph could pick up a piece of paper or Mayor Sagini and say, this is how many people we have, this is how many were mental health, this is how many physical, this is how many families, and what we brought into the shelter. But the data metrics is not impeding on one's personal privacy, but it is accountability. And I think that has to be pretty much really talked about.
Sorry, I'm not sure I captured the E thing.
Oh, okay.
Because it's a new idea, it's a new term to me, and so please, just tell me what I'm writing up there.
It's technology spec, it's the hexadecimal binary synchronous system, so just write that up. No.
Whatever.
Yeah, whatever.
Yeah.
No, it's really utilizing technology. I mean, we see
Yes.
that in our GPS, we see that in our children's phones, we see that, and we've walked down there enough with our homeless brothers and sisters. A lot of them do have phones, and we ought to integrate e-technology. For example, when they go to the road home, if they don't have to go out and queue up, could we put that on a system that's utilizing technology to say where they are when there's a space open, what they're going to do if they're out looking for a job? And I think it goes back to the integration of the whole notion of what we're trying to do in implementing a technology solution.
Okay.
And I think that goes back to the database, the repository. Once we have that, collected that information, we can really start to judge accountability and responsibility in the whole notion of it.
So, and then I know you still had more, I'm guessing.
Oh, you're fine.
Reward positive behaviors, address negative behaviors. Is there a location or a facility-related part to that I'm missing?
And maybe what it's more is the consequences of the negative behavior. You know, you can't come in here and cause all sorts of havoc and think that we're going to treat you and let you just keep coming back and forth. And I think we have to deal with that. And then the positive behavior, who knows what it is? Maybe it's an extra meal ticket, maybe it's an extra whatever. And Fred Ross has really taught a lot of this to us with his experience down on the front lines of working in the, in that community. But I think sometimes we forget that we need to reward the positive behavior, and those who are working hard to find a job and trying to change their lives and making their mental health appointments and all those type of things. And the bad behavior, we need to deal with that equally.
Okay. Would you be okay if I keep going around and come back? Because maybe,
Yeah.
we good? Yes.
All right, so just on the good behavior, best practices, what was it, 6 years ago, there was a best practices seminar that we had here at the Sheraton, where several cities, service providers from several cities came and spoke. On the positive behavior factor, the city from Arizona talked about a staged approach to moving into the inner circle of shelters, and that required space. I want to resubmit the fact that we're missing an accountability and measurements piece. On the pre-homelessness aspect, one of the presenters from that seminar was Midwest, I think it was Des Moines. They actually had caseworkers at the magistrates' offices so that when somebody's being evicted, they can catch somebody before they fall into homelessness. If we could back that up a couple months, that would be even better. You asked for missing items from your list.
I did.
So, two specific missing items I see is you don't mention parking anywhere, either for a car, for a truck, or for a bike. And you don't mention segregation of sex offenders. Currently, my understanding is that we have 12 to 16 sex offenders down on Rio Grande, and those are the ones that actually have filled out the paperwork, and they're right next to the family shelter, which I think is an abrogation of federal law. And then just two quick comments. When you talk about isolation, please understand that downtown is isolated. When we say we need centralized, Cheryl in West Valley City, when 10 minutes before she's homeless, she has an apartment and 2 kids in school. 10 minutes after she's evicted, she's still in West Valley City, and downtown is isolated from her. And then the second comment I had was services. We don't need a campus of services. We need campuses for people. There's no reason that the services can't travel to the person.
Campus of people, services, travel. Yes? You can't read it, can you? It says campus of people, services, travel. Is that?
That's
Yes.
good enough.
In this little quadrant here, yes, ma'am. Kathy.
I think one of the things we could also look at is the facility capacity. There are other facilities that are not operating at full capacity that we should just analyze for additional movement of people potentially. We should look at, for example, just the detox center. There's a capacity, if we had more operating money, we could serve more people. So we could analyze our capacity in other connected systems. Also, I think we can look at the bottlenecks. Where are the wait lists occurring for homeless individuals? They're waiting to get into affordable housing. We have this big, long list of all the people waiting. So it indicates the need for the affordable housing. Where else are they waiting? And that's what we might be able to do some facility capacity analysis.
Yes.
And you're talking about not outside the front door where they're waiting. You're talking about more
Well,
figurative.
That's part of it too, though. They're waiting there as well.
Yeah.
Where else are they waiting? There's a lot of waiting.
Yes, there is.
But you're talking about time and physical. I mean, that's what you're suggesting, Christian. Queuing and waiting because it may be months before you get something, or waiting it because it's hours before you get it.
Yes, waiting to move to
To the next.
into substance addiction
Yep.
treatment.
Okay.
Into
Right. Okay. Yes, ma'am. Yeah.
When I worked in hospitals, we staffed the nursing units and the ICUs and the CCUs in terms of severity of illnesses. And in terms of our facilities for our homeless friends, everybody goes into whatever is available as it relates to whether they have a room for a family, room for a man, room for a woman. We look at a lot of our homeless friends who have a multiplicity of problems that takes much more time. And it's been suggested that perhaps if we're going to rehab the existing facilities or move them, we should look at building facilities that would allow a large enough areas to accommodate those multiplicity of problems so that you'd have people who had so many problems and concerns who needed more care and more treatment, and thus more staff to help take care of them, because it's very time-consuming for the staff. And I look at the loads that our case managers are having right now, and it's just incredible that they get to go home at night walking and I know they're mentally exhausted. And then I'm suggesting that the facilities, when they're designed, I hate to use the word, we integrate everybody in together right now, and maybe we need to look at the special needs of people. It's the same, Stephen, as you were bringing up in terms of prevention of homelessness. When we're working with families right now to prevent homelessness, we don't just say, you're at risk of being homeless. We look at the reasons why and say, you know, if we refer you to this resource and this agency, this is going to help right away. You won't need much more. You're very capable of taking care of. So we need to look at putting people in different levels according to the kind of space they need and according to the kind of case management and care coordination that they need. Oh, okay, I think we're ready for a picture. Thank you.
Michelle?
Looping around, yes.
Oh, can I just add one thing before we?
Before we take a
Yeah,
picture,
just
this
because
one, yes.
it's from my list. The other item I saw is it doesn't look like we're looking outside the box for non-traditional short-term housing options. There's some creative ways that we could be using, you know, other facilities. One thing that comes to mind, for example, is, you know, we have highly functioning people that come in through this triage that Pam spoke of, and maybe we have a inventory, that's the word I look for, an inventory of hotel rooms and hoteliers that might have one room available for a 1-week stay. Because heaven knows if the cleaning staff can take care of Snoop Dogg, they can certainly clean up after a homeless person that is, you know, is struggling.
So non-traditional short-term housing options, for example, an inventory of hotel rooms.
Yeah.
Is that fair? Okay.
Michelle, I just want to add one to that, because Pamela's on a really good
You
point.
sure? Because I'm running.
It'll be really
it's
short.
not time to erase? Okay.
No, because this goes back to her point. And I learned this during the legislature. I haven't been up there for a long time. And this past year, we really do need a master case management system that is customized. And Pamela fought hard, and I think you got an increase of some caseworkers and some funding on that.
We got $1 million?
$1 million, but we probably need 10 million to really deal with this properly. And if we don't have a master management system, and I was looking around, who's here from the state? We need to drive that, Pamela. Yeah, we really need to drive that issue. Yeah, good.
Okay.
So I think that's key.
Where's my, yes, please. Because there's no more room to scribble on there. I'm moving back around here, just to be fair. Thank you.
Michelle, could I just add one thing?
Yes, Palmer.
It occurred to me after Gail and I were meeting with all of the groups and talking about these issues, it occurred to me that we really don't have a very clear governance model. And it came in, actually, Chief, you were in the group with Lieutenant, were you with the Lieutenant Governor as well? Just after. Because clearly we have the state and the county and the city and the feds, and the resources are coming from many sources, including all the private and religious institutions that are funders. But we don't really, it seems to me, we don't have a really clear governance system that would inspire people to look at how services are provided. I guess it fits with accountability, it fits with non-duplication of services. You know, all of our service providers are nonprofit businesses, essentially. They're not government service providers, so, you know, but they depend, most of them, on some type of combination of financial backing from both government and the private sector. But the point is that it seemed to me that there wasn't really, for this purpose, a very clear governance model. And that may be something that's missing from our discussion.
Please.
And that's really a a good point, Palmer, because none of the homeless are really from any one area either. I mean, many are from not only out of the Salt Lake City, but they're from out of the state, from all over the country. But when you ask them where they're from, I imagine they usually say from Salt Lake, because then they get in the shelter, they think, anyway.
Go ahead, Sheriff Linder.
Add on to that, I think that's very intuitive. One, in my impression, one of the other issues is that because of the wide array of service providers, and they are, in a very good sense, left to their own devices to create programs and initiatives that they feel are dealing with the problem, there really is no empirical evidence of benefit to the individual program. In other words, there's not a checklist that your program actually affects what are the underlying issues that we're trying to address, and yet that entity might be siphoning off, maybe that's a pejorative term, but might be receiving funding, yet not really impacting the global issues. And so back to this governance issue is, best case practices, someone mentioned it, is to ensure that if you're going to be a player in a system, that your entity should at least be proven to be efficacious. There is no, in my opinion, need for any service provider to prove their value, yet they can continue to provide services at will. That is not, I don't think, the best use of services.
Michelle,
Yes.
just one last thing, and I don't know if this is something we're going to attack, but panhandling. I've talked to a lot of homeless people, and they've said to me, Scott, panhandling helps me. And then they'll turn around and say, and it enables them. They'll point to somebody else that's a select group of panhandlers. It's been really interesting to hear that. So I don't know if we're going to tackle the issue on panhandling or if that's on the table, but certainly that is something that you probably need to address at some point in time. Someone needs to. Maybe it's the city council. I don't know who it is. Mayor. And I guess you're smiling because you tried that once before.
You tried it once.
You're done with that game.
Whoa. So I guess, since we're looking specifically on factors for success about location or configuration of facilities, is there something about panhandling that I haven't heard yet? Is there something additional beyond addressing panhandling, which I have, and I'm happy to put it down, but is there something more that goes with that? Yes.
A number of years ago in another forum, one of the ideas that came up was, we all have cell phones. We interact in larger or lesser degree with our homeless neighbors. And when I see bad things happening, I'm not going to engage that. I'm not stupid. But I could certainly take a photo of what's going on, and if I had a number to send it to that was managed, say, by VOA, and just throwing out some letters.
For example. Okay.
And they could attach that little bit of, information to a person's files, then maybe that might be a way to address some of the antisocial and or criminal behavior.
Okay, so coming back around to make sure that if there were key factors for success on location or configuration of facilities that we've captured, if we missed something, that I have them on our lists. I'm sort of making my sweep around. Any more? Hands raised is good too. Yes.
I just want to say, in terms of panhandling, this is one of the most discussed items and issues, and Mayor, you're very well at this. Almost 80% of panhandlers are not homeless, and I don't want to detract from the main issue that we have, but I agree it needs to be tackled. I think a lot of it, and I'm sorry Lane Beatty isn't here, but much of it is up to the businesses and their employees to tell them why not to panhandle and what the money is used for. But, even a subgroup of this, but I think it needs to be discussed outside of this meeting because of the guidelines that were set up.
but it's an issue that has to be addressed. And if we move from one spot, when we got them moved from downtown, there we found them all out at Sugar House. But the majority of them, if you follow them, as I have done, they do go to their cars, put the cards they're holding in their trunk, and then drive to the liquor store or to the drug dealer or wherever they go. They used to go to video stores, but now they've got TVs and Netflix and everything. They don't need to do that. But there are a few out there that we can spot who are panhandling for rent and utility bills, and we can put, but the best thing is to just give them the list of where the resources are. I mean, most of the panhandlers now, they just look the other way when they see me coming. They know I know who they are. They're not using our services. So I would much rather see it as a sub-committee of this group or another group that's formed. Because I think the mayor, since we got beaten in court the last time, you need some help, and maybe we can help with the Chamber of Commerce. Thank you.
Is it on? Yes.
Yeah, in addition to losing in court, which is kind of almost a parallel issue, but we also brought this issue with some suggestions really at the behest led by the Downtown Alliance and the Chamber to our City Council, and they struggled mightily and were unable to pass an ordinance they were comfortable with. That doesn't mean we shouldn't try again if we feel there's appropriate approach there. But what I'm reminded of in listening to this, which are all great, both suggestions and ideas here, is just to remind us that there is a parallel effort going on around services that the county is leading, and it goes to everything from governance to which services and how services are functioning and how we might better either coordinate or change the way those services are provided to be more effective. And all of this information will be shared so that we're not duplicating that effort too much.
And that's why I keep asking the follow-up question is, what's the facility impact of that idea, to make sure that we capture both the service aspect of it, which the county, anyway, so we get all of it. Okay, are there more comments on kind of the factors for success, or am I good with changing gears? Okay, so working with the commission co-chairs and the Salt Lake City staff that's supporting this commission, and based on what we've heard from all of you in the past 2 months, I guess it is, or actually over a long period of time, we wanted to suggest 2 community commitments and 4 community values to inform the rest of the process. And I'm going to put them up really quickly, just introduce them now, let them percolate in your mind as the next presentation about other cities that we might learn something from happens, and then give you a copy to take home with you and come back to it at the next meeting. But it's just so, because for those of you who have been teachers, you know people need to hear things 11 different ways in 11 times in 11 different ways. So here's your first time. Okay, community commitment. And okay, so we recognize that the status quo regarding homeless facilities is not acceptable. And our community has a continuing and growing commitment to care for the homeless population now and in the future. And that's really trying to reflect the openness in the community to change, and that we want to do better with homeless facilities to the extent that that's possible, and really also focusing on now and in the future to whatever it is that we plan, design, build, rebuild, whatever now, we're looking to the future and trying to anticipate what changes might be and be ready for those, or know that in 5 or 10 years, you got to think about it again. Are we still doing the right thing for the situation at the time? And then the 4 values are safety for all is a top priority, and that safety for all means all members of the community, right? Homeless individuals, service providers, volunteers, neighborhood residents, employers, visitors, et cetera, the whole thing. And essentially to separate criminal activity from legal activities in a neighborhood. The second value that we would like to suggest is it has the word value. We value the humanity of homeless individuals, recognizing that the homeless population is not monolithic. There are different homeless subpopulations with different needs. You've talked about that today in this conversation. Each homeless individual has a unique story and unique needs, and that we might actually demonstrate this value through more public education about the homeless population. It's one of the things we had been thinking about. The third value I'd like to suggest is we seek to model community at every step of the process. And that has a couple components to it. The community wants to be responsive to the needs of the homeless population. We are trying to provide facilities that support activities that create a feeling of community for the homeless population. And we want facilities that support consistency and certainty for homeless individuals and families, both during and after homelessness. Well, before, during, and after, I suppose. And the final one is that facilities should support a full range of services for the homeless population that helps individuals become self-sufficient. So that's the idea of community connectivity for all necessary services to help someone become self-sufficient, and that facilities should support a homeless individual, that they should be able to receive all needed services. So I just wanted to introduce them. I'm going to put them back up and hand them out to you before you leave, and we'll revisit. We'll sort of come back to it at the next meeting to see whether you think, sort of based on what we heard, the co-chairs and the staff kind of got it right. Is that okay? So with that, we're going to transition again, and Elizabeth and her staff have looked at, sorry.
I'm sorry, Michelle, just real quick.
Yes.
So are you saying that if we have comments on that, we should hold our comments for some other time?
So if you have comments on it, why don't share them? Yes, we will have opportunity to discuss it another time.
I'm happy
but I'm
to
also
wait,
happy to hear them. We're happy to hear them in between the meetings as well, if you like. So Elizabeth and her staff have looked at models from other cities, and I'll let her talk about it. But
thank you. And we're going to be passing around a copy of the presentation. Monday morning, we'll be sending out to each of you and publishing on our website detailed case studies from each of these cities. As was mentioned at the beginning of the presentation today, one of the questions we asked in our small group meetings were, besides these 6 cities, are there any other cities we should be looking at? And we did get a lot of great examples, and we have started gathering information on each of those examples, so we appreciate that. So just to go into really what we were trying to look at, we were looking at cities and specifically different projects within those cities that, while they offer similar services to Salt Lake, they offer them in different types of facilities. And we really broke it down into 3 types. A vertical campus, that's more of a campus model that's located in an urbanized area, oftentimes has multiple stories. We also looked at campus models that are normally a little bit further out of central cities. And we also looked at scattered site examples. So the first model we looked at was the Path Mall in Los Angeles. Now, people aiding the homeless have been providing housing programs in the Los Angeles areas for over 30 years. But in 2002, they took over an older warehouse and manufacturing building halfway between downtown and Hollywood, just 2 blocks from a subway stop. And what they did is they converted it into what they call the Path Mall. And the Path Mall on the first floor has intensive day services. You can see a picture here, right here, and where they offer behavioral health, legal support, employment opportunities, a variety of things right on the first floor. And then on the upper floors, they actually have a mix of transitional housing as well as permanent supportive housing. So that's long-term housing for individuals depending on the individual's need. The second vertical campus we looked at was Bud Clark Commons. Again, it is located in downtown Portland. And in this situation, it has very intensive shelter and day services on the first 2 floors. And then it has 130 permanent supportive housing units on the upper 4 stories. Now, this project actually came together with the City of Portland, the local county, the Housing Authority, and a nonprofit housing agency. And what's interesting about this program, not only when it was built in 2010, it was certified LEED Platinum, and they did put a lot of money into the architecture of it. But also, while it is under single ownership, it's actually two separate programs. The day services and the shelter services is run by one agency, the nonprofit Transitional Housing, while the upper four stories are run by the Housing Authority. Now, there are issues with this building. It's a beautiful building. It's providing great services, but because it is, while they're in one building, they're sort of severed in their management. There have been complaints about permanent supportive housing, and that's affecting people's reaction to the shelter and the day services that are located on the bottom two floors.
Elizabeth, back to the LA one on this governance, who governs that one?
So that is all, while there are 20 partner agencies, the PATH organization manages and organizes all the services in that building.
So is that a public or private entity?
No, it's a nonprofit.
Okay.
Yeah. The next model is Central Arizona Services, and specifically their Human Services Campus in Phoenix, Arizona. Now, CAS also runs a family shelter, but that's located several miles away from this facility. This facility is in a light industrial area outside of downtown, but it is a campus model where it has, while it's a very large footprint, it actually has very limited street frontage on how they design the building. They have a cemetery on one side and major rail lines on the other, so they actually have off minor streets. That's the street frontage. It's also a controlled campus because it has that small street frontage, and it's really a graduated program. The men's outreach shelter provides just basic needs, and people can enter that shelter for 90 days and either work with a case manager to move into their single adult shelter, or they can try to work on their own to get out of needing homeless services. Now, in the single adult shelter, that's when you have access to more supportive services, and that is actually, when you have a bed in their single adult, that is your bed for up to as long as you need. But as part of their program, you do have to be actively working with a case manager to stay in the single adult shelter.
And all these, Elizabeth, would you mind just saying the governance model of them?
CAS is also a nonprofit.
So a nonprofit.
Mm-hmm. The next is Haven for Hope in San Antonio. Haven for Hope is also a nonprofit, and it is located near downtown San Antonio, about a mile and a half away from the city core, again in a light industrial area. San Antonio, it is very similar to the Phoenix model, where it's a graduated program. You start in the courtyard, and it is San Antonio. It is a much warmer climate than we have in Salt Lake City, so actually the courtyard, it is outdoor sleeping. And when you're in the courtyard, you do have basic services. You then graduate onto their transformational campus. Part of the transformational campus is you must be a resident of San Antonio or the surrounding county. You also have to have requirements that you are working towards some type of goal. So you're not allowed into the transformational campus unless you're part of one of their programs. Huh?
Managed by?
Oh, a nonprofit.
Nonprofit.
So this is the New York City scattered site model. Now, New York City is run by New York City government. It is a city program. It's quite large, but also the homeless population of New York City is about 50,000. While it is managed by the city, they do work with nonprofit agencies to run their individual shelters. Things to point out of this system: one, it has 24/7 outreach. They partner with 311. If you encounter an individual, you don't know how you can help them, you can call 311 and they try to get outreach workers to go out to that individual to get them into services. Also, New York City, it is a right to shelter city, so that they actually have the highest shelter rate in the nation, 95%. And because of that, they are able to keep daily data on individuals they are serving. Yes.
You say 95%. 95% of all people who have been indicated as being homeless
are in the shelter. But that doesn't mean they're in housing. That just means they're in a shelter. And in New York City, they have single intake centers. This one here is actually the Family Intake Center in the Bronx. They have single intake centers for different groups, single men, single women, families, the one in the Bronx, but then they have multiple shelters. They try to spread it out across the city for the individual shelters. The comments people have heard is sometimes these intake centers are a ways out. This one is very high into the Bronx. So when people go there, often the family shelters are actually in Brooklyn. So traveling between Bronx and Brooklyn does take a lot of time. So it's hard for families to travel once they intake to get to shelter for the evening.
Is it private or public security inside?
So New York City has the City Homeless Services Department has their own security, and it's unified across all their facilities as well as facilities that contract with them to be a shelter. So it's not police, but it is a security force, and it's the same security firm from one shelter to another.
Right. And then on that one, is that the one that they require an ID for everybody?
They do ask that you have an ID, but they will work with you. Again, they do not deny shelter.
Right.
So they will find you a place for the night while they're working with you to get ID.
Get you ID, right.
And finally, we looked at Denver. Denver is the closest example to Salt Lake City. While it's scattered site, most of the services are centered along Broadway, just outside of downtown Denver, just east of Coors Field. But the difference really between Denver and Salt Lake is their largest day center, St. Francis Center on the right there, that can help 700 people a day, while their largest shelters, Denver Rescue Mission, only has 300 beds. Now, an issue with Denver is because it is scattered site, oftentimes it might look like there are more individuals on the street, because if they go to one place and they can't find a bed, they then have to travel to another location to try to find a bed. Yes, Pamela?
What a variety of daycare services do they offer for 700 people?
It's very basic services.
Okay.
While they have some sort of like community health center, it really isn't as intense as, say, the Path Mall.
Thank you.
Elizabeth, that's a city run, isn't it?
No,
Is that state?
it's actually run by multiple organizations.
Okay, under the government's model.
Well, it's scattered site, but they all go under a continuum of care, but for this example, there's no one entity.
Yeah, and then New York is the city run.
Is a city program, yeah.
So the city is taking that off.
And those are just a quick snapshot of the case studies we looked at, and again, we'll be sending out very detailed. Yes, sir.
Elizabeth, you mentioned it for New York, but can you give us a sense of how much of the demand for homeless facilities is served in those places?
So I would say in Los Angeles, that it's interesting. While New York has the highest shelter rate, Los Angeles percentage-wise actually has the lowest percentage rate of sheltered individuals. Denver is very close to us in its shelter rate, where most of their homeless population is sheltered. But then for the other three cities, it's similar to ours, but it's actually a lower shelter rate than we have here in Salt Lake City.
Elizabeth, will you be looking at more as this process goes on?
As I mentioned, we received a lot of great examples, and we have started research on those. We just haven't prepared case studies yet.
Liz, it seems like it might be helpful to us to really kind of get also the feedback from those cities about what they think are the pros and the cons of these different models.
And that'll actually be included in the case studies. We reached out to not only the providers, but also the larger community, asking the pros and cons.
Great.
Yes?
So with these models, are we also going to be looking at agencies that participate and agencies that don't participate? So specifically with CAS, Phoenix Rescue Mission didn't participate. They're 3 miles down the road, and they've expanded 3 times since CAS was established. And in New York, I'm curious if the New York's Rescue Mission participates in that model or if they don't, because there's multiple, even though these may be main homeless service centers, there may be multiple other agencies providing homeless services in addition to.
And while we did look
To the
at
case in
other,
point.
we looked at other area services, we did not go to the level of, did they participate with this model or not, but we can do that and provide you that information.
Well, you're going to correct me if I'm wrong, but to be fair, I think what they were looking at was sort of physical structure. More than somewhat, some of these questions are getting at, and yours is sort of governance and who participates in institutional arrangements. I think that's not at first what you were looking for.
Correct.
Right. But Michelle, just to be fair, governance does inform structure, facilities. If
Elizabeth, there's one that the coalition had looked at, and that they're about maybe 5 steps ahead of us right now. It's in Placer County. It's Sacramento. And they have gone, I think they're doing the steps that we're doing right now, except they're a little bit farther ahead. Is that one that we could put on the list to kind of reach out to?
It is, and that's one we noted in our breakout
Great.
session, and we have started researching.
Great.
Awesome.
Maybe we can learn from that.
But I do need to let you know that some people from Sacramento called me about what we've been doing with our continuum of care and with the permanent supportive housing, and they're going to do a tour through Lloyd, Pendleton. They're one of several dozen cities that have called to come and see what we're doing with the permanent supportive housing.
The one that Fred Ross always tells us about is Las Vegas, too. I forgot what that was called.
It's Catholic Charities, and that's on the list as well.
Oh, okay, yeah. Brad, you probably know about that one.
Are there other, based on, so clarify, at least for me, they just received copies of case studies, right? Should you?
There will be, the full case studies will be sent out on Monday. This is just a snapshot.
And the full case study
Yes. Though they do not include the other examples that were suggested during the small meetings. Yeah, exactly.
with a little more information and pros and cons, I gather, but it's probably not governance because that's not something.
It actually does have
It does
government.
have that on. Okay. Other questions today?
I'm not in the group. I read an article today where the mayor of Washington D.C. is trying something new with their homeless situation too. So it might be something you might want to include in your case studies.
Thank you, I appreciate that.
What was the article that you read?
Yeah,
It was.
no idea. I just know it had to do with Washington D.C. and moving from like the centralized.
Yeah.
Several smaller shelters. Just
Okay. And so there were, I don't remember how many other cities were suggested in the small group meetings, but the list looks relatively long.
About 12.
12, in addition to the 6. And what are you telling the group about those 12?
So we are not going to be conducting full case studies of those other 12, but we are doing just short research, no more than half a page of information on each.
Okay, so with that knowledge, if you suggest, and we've got Sacramento, Las Vegas, and Washington as suggestions that for a variety of reasons one of you thinks is important, any others that you think perhaps warrant more than a half-page analysis, and if so, what would you like to stop and look at in particular?
Can you tell us the names on the list, or do you have it handy on?
I do not have it
Oh,
handy.
that's okay.
But what I can do is when I send out the case studies on Monday, I can send out the list of the other cities that we're looking at.
Right. The other cities, and then if there is one that any of you would like to have a more extensive case study on, please really identify what it is about that one you want us to focus on, right? So that we know what to bring back to you so that it's actually providing you information that you want rather than just thinking for care about it. Yes.
For Liz's information, we can give you detailed information about Las Vegas if you want that information.
Okay, good. Okay, so that's case studies, and we'll come
Michelle,
back to, yes,
can I ask
I'm
just
sorry.
one more question on this?
Yeah.
So one of the issues, obviously, we have here, and I just don't know to what extent it applies in these other communities, other than my own observations in some cases, is how these facilities are fitting in with the neighborhood where they're located.
And that's something that is in the case studies. We're looking at what the surrounding uses are. We're also looking, frankly, at are there complaints from the neighborhood, things like that, talking with the service providers themselves, how they're able to provide services in those facilities.
Okay, thank you.
So we're actually running ahead of schedule. I don't know whether you're good with that or not so good with that. Do you have anything else to do with your time? All right, so next handout is the commitment, the suggested commitments and values that you can take. Oh, it's in 2 packets if you like. And again, if you have comments on them between now and the next meeting, please feel free to share with me or Elizabeth. And then we can have a discussion about it at the next meeting as well, after you've had an opportunity to kind of think about it. And the final thing that I think we wanted to do is just, you have the schedule for the process. Oh. For the process. And I have another slide, but we're going to get there soon. I have a little more detail to give you on sort of what we're thinking about this commission's process moving forward. And you'll see when we get to the slide that it's referred to as a tentative process. The dates are not tentative, but what we're going to do on each date is a little bit tentative because it kind of depends on your interests and what we learn and where the conversation goes. That's how these things work. There we go. So March 20th is today. And we did factors for success, drawing those out of what you all have shared with us. And we did some models from other cities. And between meetings, so between the March and the May meeting, there will be a public input session on the factors for success. And there's actually a date. I didn't have a date when I made my slide, but I think on your piece of paper, is there a date for that public input session? That's good. April 27th. April 22nd. And so you're all welcome to come and learn from whomever else comes, provide public input, whatever you'd like to do. But you're welcome to come to that public input session. And then there's also some learning opportunities that Bill Evans and the staff have kind of put together that we encourage you to do between the 2 meetings. And we have a sign-up sheet for you, which, do we have a sign-up sheet? Good. And the idea is that there are tours of the Rio Grande area. And so these are 2 different kinds of opportunities. We encourage you to do one of each. So tours, if you haven't already done it, of the Rio Grande area. And then some of the other things are personal experiences with our homeless friends. I did that as the shorthand for it. But it's basically volunteer opportunities or tours of some of the facilities, some of the homeless provider facilities and services. And when the sign-up sheet comes around, it is going to come around. Okay. And then on May 22nd, we have the next commission meeting, at which I now should close my PowerPoint down and add something to it, because we're going to have more case studies, because you've just asked for a few more case studies. And we are going to, at that meeting, develop criteria for identifying location and configuration of homeless facilities. Yes, ma'am.
And on that date, we're going to change that date because that's a Friday of Memorial Day weekend. And so we're going to work with our commission chairs and get you out a new date, but it will be the last couple of weeks of May. So timing will be similar, but the exact date will change.
For the 22nd?
Yeah. So we'll let you know by Monday a new date, end of May.
So, and at that meeting, we'll do a few more case studies to inform, and based on these factors of success and the additional key factors that you identified in our discussion, we'll have some proposed criteria that you can talk about and develop some criteria for identifying location and configuration of homeless facilities. Then between the May and the August meetings, we're going to set up some tours of homeless facilities along the Wasatch Front, specifically Ogden and Provo, if you're interested in going to see what they're providing. At the August commission meeting, going to do an evaluation of the different models and finalize the criteria, and you, as a commission, can give direction to the Salt Lake City staff about what criteria they should be looking at to identify possible locations and configurations. And they will come back with that in November. You can review, and we'll talk about the possible locations and configurations that meet some or all of those criteria. Between the November and December meeting is another public input session on those possible facilities. And in December, hopefully, we'll be able to develop your recommendations as a commission on location configuration of facilities. Yes?
Is an option stay in where it is, the shelter, or is it?
Yes. I guess I shouldn't answer, but Mayor Becker is nodding his head, and my understanding from the get-go has been that sort of everything is on the table, from sort of essentially keeping things the way they are now, perhaps with changes, to something totally, totally different, and anything in between. Yeah, that's my understanding. Yes.
Are the police represented here today? The police? Are they?
Not to, but they are on the commission. Oh.
Yeah, I wasn't asking about the sheriff, but I was.
So, and at the first meeting, Fred Ross, is that his name, was sitting over here. So
Right.
I remember,
I
yeah, and
understand
so
that.
today apparently was an.
So will somebody be explaining to them that the number one thing out of all of the meetings was safety then, and security?
Yeah, they are closely tied in to this work.
Yeah.
Okay.
Does that answer your question? Yes.
Sure.
I think the answer was yes. Okay, good. Maybe I should say yes, like my assistant says. Yes.
Can you email us out?
Okay, email that out. Yes. As long as you promise that the tentative piece up there, you know that this is tentative, because it may change kind of based on where your conversations go in each meeting. But yes, we can do that.
Along the same lines, if when things become firm, if you could send out a calendar item so that we can double click on that, and it makes life a lot easier.
You mean like an Outlook calendar invitation?
That would be
Is that what you're
glorious.
suggesting?
Well, no, I use a Mac, so yeah, but.
I'm told that they're already planning that. I like those myself. They're good.
See,
'cause
Michelle,
then,
you're learning technology.
hey, as an old lady, I'm going to learn some of it. That's why we have assistants.
Yes.
Yes, so there, on that sheet that listed the opportunities, there are contacts for the individual organizations, Catholic Community Services, the Road Home, Salt Lake City Police, and also Housing and Neighborhood Development. We'll also, when we send out information on Monday, we'll also be including that information on the opportunities to sign up.
It's more than just listing. I want to go visit Brad.
It's just, we're contacting it, we didn't know what your individual schedules would be, so we thought it'd be easier for you that if we let it, at your convenience, contact that organization that you would like to participate and learn more.
You could be given tours to individuals every day between now and that way.
We are going to try to group it. It was just, frankly, it was just trying to find balance between everyone's schedules, and also, it was just a balance, and that's why we ended up putting the individual contacts.
Cheers.
Okay, thank you very much. I hope you enjoy your tours and your volunteer opportunities, and we'll see you May, not the 22nd, May, a date to be named.